Have you ever imagined that a simple drink before a romantic encounter could trigger a serious health crisis, or, in extreme cases, even put your life at risk? Picture the scene. It is a Friday night. You are out at a bar or a nice restaurant. The atmosphere is perfect, and you're having a few drinks to relax. It is a very common scenario. And in this exact scenario, it is increasingly common for men to use Tadalafil, the famous little pill that helps treat erectile dysfunction, to ensure everything goes smoothly later in the night. The logic seems sound. The alcohol helps you relax socially, and the medication secures the physical performance. But have you ever stopped to ask if this mixture is actually safe? Or could it transform a fun, relaxing night into a potential nightmare? In recent months, there have been numerous reports and discussions regarding intoxication in nightlife settings, and it brings up a crucial question about what we are putting into our bodies. Today, we are going to break down exactly what happens biologically when you mix alcohol and Tadalafil. We need to look at the risks involved, the chemistry of this interaction, and identify exactly when this combination stops being a social habit and starts being a severe problem for your health. To understand the danger, we first need to understand the mechanics of the medication. Tadalafil belongs to a class of drugs known as phosphodiesterase type 5 inhibitors. While that sounds complicated, its job is actually quite straightforward. It is used to treat erectile dysfunction and, in some cases, benign prostatic hyperplasia. The way it works is by improving blood flow. It targets the smooth muscles in the walls of your blood vessels, specifically in the pelvic region. By relaxing these muscles, it allows the arteries to widen. When you are sexually stimulated, this relaxation allows a significantly larger volume of blood to flow into the corpus cavernosum, the sponge-like tissue in the penis, facilitating an erection. It is important to remember a key detail here. The medication facilitates the mechanics of the erection by lowering vascular resistance. It clears the road for the blood to travel, so to speak. However, for the car to drive down that road, you still need the engine to be running. That engine is your brain and your nervous system, which brings us to the second player in this dangerous equation, alcohol. Many people view alcohol simply as a social lubricant, something to take the edge off. But biochemically, alcohol is a drug with potent effects on your cardiovascular system. Just like Tadalafil, alcohol acts on your blood vessels. Have you ever noticed that after a drink or two, some people get a flushed face or feel a warm sensation spreading through their body? That is physiology in action. Alcohol is a vasodilator. It causes your blood vessels to relax and widen. When your blood vessels expand, the blood has more room to move, which naturally lowers your systemic blood pressure. This happens to almost everyone who drinks, even without any medication in their system. It is a temporary, usually manageable drop in pressure that the body compensates for. However, this is exactly where the danger lies when you introduce Tadalafil into the mix. You are essentially taking two powerful agents that do the same thing to your circulatory system. You have the medication, which is chemically designed to widen blood vessels to lower resistance, and you have alcohol, which is also widening your blood vessels and lowering resistance. When you mix them, you risk creating a synergistic effect, a double drop in vascular resistance. This leads to systemic vasodilation. In plain English, your blood vessels open up too wide, all at once. This can cause your blood pressure to plummet. This is not just a minor inconvenience. A significant drop in blood pressure, known as hypotension, can be dangerous. The symptoms often start with dizziness or a feeling of lightheadedness, especially if you stand up quickly, a condition called orthostatic hypotension. Because your pressure has dropped, your heart has to work overtime to pump blood to your brain and organs. This leads to palpitations. You might feel your heart racing or pounding in your chest, even though you are just sitting down. In more severe cases, or if you have consumed a large amount of alcohol alongside a high dose of Tadalafil, such as the 20 milligrams dose, this drop in pressure can lead to fainting or syncope. Passing out in a bar or a bathroom poses its own risks of physical injury from the fall. But physiologically, the stress this places on the cardiovascular system is significant. You are effectively putting your body into a state of shock where it struggles to maintain adequate blood flow to vital organs. Beyond the cardiovascular risks, there is a massive irony in mixing these two substances. Men usually take Tadalafil because they want to ensure peak performance. They want to be sure they can get and maintain an erection. But alcohol, despite being a vasodilator, is primarily a central nervous system depressant. Think of your body like a house. Tadalafil fixes the plumbing. It ensures the pipes are wide and clear for water to flow. But alcohol messes with the electrical wiring. It dampens the signals firing in your brain. It reduces sensitivity and slows down reaction times. For an erection to happen, your brain needs to send clear, strong signals through your nervous system to the blood vessels, telling them to let the blood in. Alcohol inhibits these signals. It reduces the neural stimulation required to trigger the process. So, you end up in a situation where the medication has prepared your body physically, but the alcohol has sedated your brain chemically. This leads to the frustration many men experience. They blame the pill, saying it didn't work or was a bad batch. In reality, the pill was working perfectly fine on the vascular system, but the excessive alcohol consumption shut down the neurological triggers necessary for the event to occur. This is often referred to colloquially as whiskey dick, and it is a direct result of alcohol sabotaging the very outcome you were trying to guarantee with the medication. And this balancing act, trying to time your medication with your drinks just to avoid failure, is exhausted. It forces you to rely on a chemical crutch that often snaps under pressure. But what if you didn't need the pill in the first place? There is a bizarrely simple, 7-second natural habit that thousands of men are using to restore natural blood flow and fix the root cause of the problem, so you don't have to stress about pills or timing your drinks ever again. If you want to see exactly how this works, take out your phone and point your camera at the QR code on the screen right now. It will take you to a short video that explains this purple tonic method that's changing everything. I've also pinned the link to that video in the top comment below. Go check it out if you're tired of the side effects and the uncertainty. But speaking of uncertainty, we need to address a darker, more serious risk that has emerged recently, particularly in tourist hotspots and nightlife districts. There has been a rise in cases involving adulterated alcohol, drinks that have been cut or contaminated with methanol to save money. Methanol is a highly toxic form of alcohol. It is not meant for human consumption. Unlike ethanol, the alcohol in your beer or wine, methanol is metabolized into formaldehyde and formic acid, which are incredibly poisonous. Even small amounts can cause blindness, permanent kidney failure, and death. Here's why this matters in the context of Tadalafil. If you are taking a vasodilator like Tadalafil, you are increasing blood flow and potentially altering how substances are absorbed and distributed throughout the body. While the research on this specific interaction is ongoing, the logic of physiology suggests that if your blood vessels are dilated and your circulation is accelerated, the absorption of toxins could potentially be faster or more profound. If you unknowingly consume adulterated alcohol while on a PDE5 inhibitor, you are already in a vulnerable state due to the potential blood pressure drop. Adding a neurotoxin like methanol to that mix creates a medical emergency that is difficult to treat. The symptoms of methanol poisoning, confusion, dizziness, nausea can easily be mistaken for simple drunkenness or the side effects of the hypotension we discussed earlier. This delays seeking help, which can be fatal. The risk profile of a night out changes drastically when you consider that you cannot always be 100% sure of the quality of alcohol being served in every establishment. Does this mean you can never have a toast at a wedding or a beer at a barbecue if you use Tadalafil? Not necessarily. We need to look at what the clinical data says to find the balance. Studies on PDE5 inhibitors generally show that small, moderate amounts of alcohol do not cause severe hypotension in healthy men. We are talking about the definition of moderation, perhaps a glass of wine or a single beer. In these controlled scenarios, the additive effect on blood pressure is usually negligible for a healthy individual. The danger zone is entered when that moderation is lost. Binge drinking or consuming alcohol to the point of intoxication is where the safety data falls apart. The more alcohol you have in your system, the more profound the vasodilation, and the more severe the depressant effect on the brain. Furthermore, there are specific groups of people for whom this combination is strictly off limits. If you have a pre-existing heart condition, if you take medications for high blood pressure, especially alpha blockers, or if you use nitrates for chest pain, you must never mix these substances. The combination can lead to a fatal drop in blood pressure. Additionally, older men, whose bodies do not metabolize substances as quickly and whose blood pressure regulation might not be as robust, are at significantly higher risk of fainting and injury. Ultimately, the secret is always equilibrium and understanding your own biology. Many men end up drinking far more than their body can handle, and then are surprised when the medication fails, or when they feel terrible physically. The problem is rarely the medication itself, but rather the abusive quantity of alcohol paired with it. If you rely on Tadalafil or similar medications, the safest advice is to keep alcohol intake to an absolute minimum or eliminate it entirely on the nights you plan to use the medication. You are taking a pill to improve your vascular health and performance. Drowning your system in a depressant toxin like alcohol is counterproductive to that goal. Always know what you are drinking and avoid places of doubtful reputation to mitigate the risk of adulterated beverages. And most importantly, never start a regimen of Tadalafil without talking to your doctor, especially if you enjoy drinking socially. They can look at your specific medical history, your current medications, and your blood pressure profile to tell you exactly where your safety limits are. Your health and safety should always come before a night of partying. Understanding these interactions ensures that you can take care of your body and avoid turning a simple evening into a medical statistic. Stay informed, stay moderate, and prioritize your long-term health.